My name is Kurt Anderson. I'm a orthopedic hand surgeon, lives in Bellevue, works for Proliance Hand, Wrist, and Elbow Physicians. I went to medical school at the University of Arizona after graduating from college in Colorado. I was working in the state of Arizona and got into the university and decided to stay.
What attracted you to a hand specialty?
I actually went to medical school to be an emergency room physician, but during the period that I was in Tucson or in medical school, I actually spent my free evenings in the emergency department and ended up doing a lot of suturing of lacerations from car accidents and other accidents. And so I found that I liked working with my hands, and one thing led to the next, and discovered orthopedic surgery and found my niche. Here at Proliance Hand, Wrist, and Elbow, there's 2 of the 4 partners that do elbow. I do the vast majority of elbow for the group, including trauma, lateral epicondylitis, bumps and lumps, and arthritis, probably most importantly.
Yeah.
The most common thing I see are fractures, tennis elbow, which is tendinitis, and then arthritis. And in our population, we see a lot of early to moderate arthritis that's not too severe.
And how many locations do you practice at?
So Proliance Hand, Wrist, and Elbow has, I think, 5 locations right now. I personally go to Kirkland, our main office, Bellevue, our second office, Redmond, and then Issaquah, depending on the day. So I kind of make a little square.
And if I had to have a surgical procedure, would we do it in the hospital or in an ambulatory surgery center?
That's a patient-dependent issue. We like to do, or I like to do, as much surgery as I can in our surgery center because it's where I do the majority of my surgery. Certainly hand surgery, based on the timing of the surgery and the size of the surgery, most patients can easily go home. But we're actually finding now that surgeons are able to do knee replacement and hip replacement, and patients go home and they walk out. So that's fantastic. I think all 4 sites that I go to are very convenient. We have our own parking lot for 2 of the buildings, and then 2 of the buildings are actually Swedish parking lots, and they're gigantic.